Hello everyone, myself Dr. Namrata Vitlani. In this video, I will give you information regarding the Berlin definition of ARDS, that is the acute respiratory distress syndrome. So in this definition, we have four components. First component is timing. So the timing duration of the symptoms, they should be within the 7 days of the known clinical insult or the appearance of the respiratory symptoms, new or worsening respiratory symptoms within 7 days. So first is the timing, it has to be within 7 days. Next thing is the chest imaging, presence of the bilateral opacities either on the chest x-ray or CT scan which are not explained by lung collapse, effusion or nodules. Then third thing is the origin of edema. So the bilateral opacities, pulmonary edema which are not of cardiac origin, that is not explained by the heart failure or volume overload, we can use echocardiography as an objective evidence. And fourth thing is the oxygenation. So how is the severity of the hypoxia? So we may use PaO2 FiO2 ratio for the severity assessment, that is the mild, moderate and severe. More severe is the ARDS, more is the mortality of the patient. So less than 300, so that is the mild ARDS. Less than 200, it is the moderate symptoms, and less than 100 PaO2 FiO2 ratio, it is the severe ARDS. So 200 to 300 it is the mild, then 100 to 200 it is moderate, and less than 100 PaO2 FiO2 ratio, it is the severe ARDS. So basically in the Berlin definition we have that onset of the clinical symptoms within the 7 days of the clinical insult, or new or worsening respiratory symptoms within the 7 days. On the chest imaging, we have bilateral opacities which are not explained by the lung collapse, effusion or nodules. And third thing is that this pulmonary edema, it is not of cardiac origin, that is not explained by the volume overload or heart failure. And fourth thing is the severity assessment, that is the PaO2 FiO2 ratio, accordingly mild, moderate and severe ARDS. So this is about the Berlin definition of acute respiratory distress syndrome. Thank you. I hope you find it useful.